Are you struggling with depression or PTSD? A recent poll revealed that nearly 30% of adults report they've been diagnosed with depression at some point in their lifetime. And when traditional treatments fall short, more and more people are now turning to a promising breakthrough therapy called TMS for hope and relief. I'm here at KMG Psychiatry, a practice that has been recognized as one of the best in San Diego for providing high-quality, compassionate care and innovative treatments to help people dealing with mental health issues. I'm here with psychiatrist Dr. Ankur Bindal, president and founder of KMG Psychiatry. Thank you for having us into your beautiful practice.
Absolutely, Laura. Welcome.
You specialize in helping patients find new paths to recovery and help break the stigma of seeking mental health treatment.
Historically, mental health had a lot of social stigma, and over the past many years, there has been a lot of community efforts in destigmatizing the mental health. KMG seconds that movement, is supportive of mental health being given priority. Historically, depression has been treated with medications, but now there have been advancement, FDA approval, and approval from insurances, which have a very high response rate.
And let's talk about one of those breakthrough treatments. Tell us how TMS therapy is helping to revolutionize depression treatment.
It is a very easy, non-invasive, non-painful, non-shock treatment, which is FDA approved for treatment of refractory depression. TMS is available to most individuals who have not responded well to one antidepressant treatment. In many ways, does not carry a lot of adverse side effects.
And so, just so our viewers know, this is not new. It has a history of study and encouraging outcomes.
TMS has been widely studied for 20, 30, 40 years. Transcranial magnetic stimulation received the FDA approval in October 2008. So now it's covered by most insurances.
And TMS therapy is approved to treat a wide range of conditions. Tell us about them.
What we call major depressive disorder, anxious depression, obsessive compulsive disorder for certain TMS modalities, and also smoking cessation. Off-label, it's very helpful for treating post-traumatic stress disorder, for ADHD symptoms, for anxiety. The good news is that now we have an FDA approval for ages 15 and above.
And can you walk us through the experience when a patient walks through those doors for a treatment? What can they expect?
It's a very outpatient procedure. They walk in to one of the suites. They get put in a very nice, relaxing, reclining chair that does not require you to be assisted by any individual. And we are giving and delivering a localized targeted magnetic field to a certain part of the brain that controls and releases more serotonin, which hypothetically is responsible for improving the levels of your mood and decreasing the depression. Because the TMS is being delivered locally in a very natural way, magnetic field, the chances of the systemic side effects are absent or minimal. So you can expect to hear some noise, the clicking noise, which is 4 seconds at a time, and then there is an 11-second break for 18 minutes at a time. During that time, you can get distracted by music, by watching some TV, or we also provide earbuds for noise cancellation.
I can imagine this can be life-changing. Tell us about your patient feedback.
It is a very, very, very effective treatment. Not only does TMS help in reducing depression and anxiety and a lot of clinical symptoms, but in overall making a very huge impact on their personal, professional lives. They are able to be more happy, more involved in the care of their family members, more productive in work. So it has a huge impact in their lives in a 360-degree manner.
And you have 3 KMG Psychiatry locations, San Diego, Vista, and Chula Vista. This is really a promising treatment for so many here in San Diego.
It is an amazingly promising treatment, especially in this city where we have the most amount of military presence. A lot of those folks are suffering from a lot of depression, post-traumatic stress disorder, and with the very high response rate, this could be a game changer in the way we are looking at life and in the way we are treating depression and anxiety and a lot of other conditions.
Now, if someone is listening right now and they're curious about TMS therapy, what is the next step?
Visit our website and request an appointment online, or just pick up the phone and call, and they can easily connect with one of our providers.
Are you ready for a positive change? Your journey to better mental health starts here. Call KMG Psychiatry at 888-683-3860 or book an appointment online at kmgpsychiatry.com.